Hi, my name is Oswaldo. I study medicine in the UB Universidad Veracruzana from Ciudad Mendoza, Región Córdoba, Orizaba. Today I will talk about the digestive system from embryology. The digestive system is divided from the endodermal germ layer, which forms the epithelial lining of the gastrointestinal tract, and from is the splenic mesoderm, which form connective tissues, smooth muscles, and blood vessels. Okay, um, First, division of the gut tube. The primitive gut tube is divided into three main regions. One, foregut from the pharynx to the duodenum. Two, midgum from the duodenum to the proximal two thirds of transverse colon. And three, hindgut from the distal third of the transverse colon to the anal canal. Next. Each region is associated with a specific arterial supply. Number one, celiac artery for the foregut, and two is the superior mesenteric artery for the midgut, and three is inferior mesenteric artery for the hindgut. The phyloid forget of structures. Number one, esophagus develops from the foregut just caudal to the pharynx, and initially short, it's elongated rapidly. And two is the stomach. Appears a dilatation of the foregut is a clockwise rotation and a differential growth from the greater and lesser cubatories. And three is the duodenum, formed from the varigut and midgut, and it's rotated and becomes C-shaped. Its lumen is temporarily obliterated and then recanalizated. And four is liver and biliary apparatus. The liver develops from the hepatic diverticulum. The gallbladder is and the plic ducts and develop from the cyclic diverticulum. And five, finally, is the pancreas. Arises from dorsal and ventral pancreas buds. The spheres after duodenal rotation. The phyloid is the midgut is, for example, physical urination. When the midgut grows rapidly and herniates into this umbilical cord around week 6. And rotation in the gastro is the choose. Next, return to abdomen. The midgut return to the abdominal cavity around week 10, and formation of intestines and the small intestine from first, followed by the large intestine. The carum appears as a swelling in the appendix, forms a narrow diverticulum. And finally, clinical correlations. Esophageal, for example, esophageal atresia and tracheoesophageal fistula, pyloric stenosis, annular pancreas, malrotation and volvulus of intestines, omphalocele and gastroschisis, omphalocele and mecal diverticulum, and finally imperative anus and each prong disease. This is the finally. Thank you so much. Bye.